Interestingly, fish is really good, but you're going to hear controversial things about fish because fish can also have mercury, and you want to be very careful about mercury restrictions. So there's 4 fish that people never should eat. It's mercury, and that are mercury containing, that are very high: king mackerel, shark, swordfish, and tilefish. And there are good reference places like the CDC and the FDA have great websites for patients to go to if they want to look for those. There are also some misconceptions about food. People sometimes say, well, I know I can't eat fish or I shouldn't eat fish. You actually do want to eat fish, and we give patients prenatal vitamins that have DHA. DHA is actually alpha omega fatty acids that are very, very good for brain development, and those are derived from fish. So that's actually put into the vitamin now, and the reason we put that in is that there are studies that have shown that if babies have DHA, about 300 milligrams per day, they have a whole standard deviation higher on their IQs. So this is like a nice way. And then, so for the moms who come in and say, oh my God, I hate fish, I never eat fish, my baby's not going to be smart, you can reassure them if they have a prenatal vitamin, they can sort of reassure themselves that they're still getting that benefit from the fish oil. But for people who do like fish, we actually tell them 2 to 3 helpings of fish per week is what's recommended, with the exception, of course, of the 4 bad fish. And those 4 bad fish, we tell everyone, that's not just in pregnancy, that's for any adult, any child. Those are the fish to avoid. Then as far as other fish, some are better. Shellfish tend to be low in mercury. Those are good to eat. Things like tuna and salmon, we say 1 to 2 times per week. And again, if someone's not sure, the CDC or the FDA have great websites as reference sources that people can go to. Interestingly, sushi is now okay for pregnancy. Everyone always looks at me and says, oh my God, I can't believe I can eat sushi. But the interesting thing about sushi was that sushi was restricted because of parasites, and everyone worried about the parasites. The FDA changed laws on sushi recently. It's flash frozen, so technically there's no such thing as fresh sushi now. Everyone is getting frozen sushi, so the parasite issue is taken care of. So you follow the same mercury restrictions.